Hello, everybody. We are so happy to be here today, Haley and myself, Lemecia, to do our first ever integrative medicine vlog. And we're just excited to be able to come together and share with you some information about integrative medicine, holistic health, functional medicine, all sorts of good stuff that can be helpful for you in your life to support you on your path to wellness, whatever it is you may be experiencing, physical issues, emotional issues. And we just wanted to thank you for listening to this vlog as we get started, and hope to be able to hear more, get some ideas from you as we go along about what it is that you might want to know about and in the way of health and wellness. So if we could just start, Haley, can you introduce yourself, and then we can get going on our vlog today. The topic is, what is integrative medicine?
Absolutely. Well, thanks, Lemecia. And yes, I'm Haley Vilhauer, registered dietitian and functional nutritionist. And I have been practicing for the last 18 years in the field of nutrition and have just really come to understand and appreciate how working with practitioners that have opposing but complementary resources and insights and specialties can really just allow for the health of our clients to move forward in such a beautiful way. And so in my practice, I do a lot of food sensitivity testing, but I really work on getting to the root cause with individuals. So I'm very much excited about this topic that we're launching, and yeah, happy you're here.
And I just love being able to work with you, Haley. We both work at Vancouver Wellness Studio. Our contact information's on the screen. Even though we're solo practitioners, we come together as part of a holistic group practice where we practice integrative medicine. And so I'm just happy to see you every day, be able to share clients with you. My name is Lemecia Lindsey, and I am a licensed clinical social worker. I've been in the field for, since 2000, so a little over about 20 years. And I work with adults with trauma. I specialize in using EMDR therapy, which is a form of trauma treatment, and neurofeedback, which is a newer addition to my practice. And yeah, I love the idea of getting to the root cause of mental issues or emotional issues for people, and helping them to get better and stay better. And I love the integration of natural medicine to be able to help clients support their wellness and their journey to health.
Yes.
So what would you say integrative medicine is, Haley?
Oh, such a great question, Lemecia. So to me, when you say the word integrative, it truly means collaborative care. It means focusing on the mind, the body, and the spirit. So it's kind of this multifaceted word that gets me really excited because I always think, sometimes people show up in our offices for therapy or for counseling or coaching of some sort, and they maybe haven't understood even in their own walk that integration and how we can't just talk about food. In my instance, I always say it's not just about the food. It's really about treating the whole person. And in order to do that, we do need to pay attention to some of the things like stress and sleep and movement and their relationships. outside of just their basic, hydration and nutrition needs. So for me, that word integrative is just a big explosive word that really looks at this person's history, their story. I always tell people their story matters so much, that from preconception, what was going on with even your birth mother, and then all the way forward until they present in our offices, that all of that comes into play when we're talking about integrative medicine. It's not just what are the symptoms today, but it's really starting to look more holistically at that individual.
Yeah, I love that. I love just the idea of really being able to look at the whole person in their environment, the whole person's history. Um, I know that you do a lot of functional medicine, functional nutrition, which incorporates a lot of testing. So it's bringing in science. I think all of like the cutting edge science tools that are available, and just really being able to spend the time with clients to get to know them, and just to really understand them from a whole person perspective.
Yes.
Yeah. Some of the principles of integrative medicine, I was looking up just to uh, kind of compare my idea of integrative medicine
Sure.
to what the experts say. And it sounds like they're saying treat the whole person. We get to the root cause, which I think EMDR does. In the type of therapy I do, I think it just does incredibly well getting to the root cause of emotional and mental issues for people as it relates to trauma.
Absolutely.
I love the fact that it integrates different holistic wellness practices like acupuncture and yoga and massage and mental health and personal fitness, nutrition, neurofeedback. And then it's really looking at, it's not just treating symptoms, but it's really looking at prevention for people as
Yeah.
well. What are your thoughts about those topics?
Well, I think you kind of nailed it in the sense of you mentioned acupuncture and yoga and massage and neurofeedback. And I think oftentimes when our body is in a state of unrest, or when we're just really not feeling our best, when wellness is not there, oftentimes we're really just kind of seeking, and we're trying to figure out, okay, what is that thing that my body needs most? And really the answer when clients come in here, and like, there's no one diet plan that I'm going to put you on that's going to, fix everything. We have to look at all of the things going on in your systems, because all of our organs are connected. And as I mentioned before, mind, body, spirit, like, we are such interconnected beings, that if we really only look at symptoms, we're doing a disservice to those clients. And that we're able to, I always say, widen the lens. When we widen the lens from just that presentation, we can start to bring into view how these other complementary services might enhance their healing process, or might enhance their wellness, or might even, of course, with symptom management, we want to, lessen the amount of unfavorable symptoms that someone is experiencing. But it usually is this beautiful combination of resources that is going to give that person the best opportunity to feel well quicker. And so kind of honoring that, I always like to ask clients, like, what are you up for? How much of this do you want to take on at right now at this time? Because everyone is so unique. And I think that's what we have to remember with integrative or holistic medicine in general. And with the type of work that we're doing here at the Wellness Studio, certainly is just honoring how those clients are ready to progress, or what they're really willing to do.
Right. Well, and I think you're talking about individualized treatment, individualized care plans, individualized nutrition plans, that everybody is so unique and they're at different stages in their journey and their healing. And I think we really look at clients from a strength-based perspective. What are they already bringing to the table? That kind of the idea that they have everything that they need, that we're just helping to kind of clear the path for them, or lighten a load or a burden, or prime their system to be able to receive and heal and, and perform in the way that their bodies want to perform and minds want to perform, and hearts want to perform. So I love the fact we're just individualizing approaches and just kind of clearing the path for people so that they can be the best version of themselves.
Absolutely. And I also love the idea that, like you mentioned, we want to highlight what clients are doing well, because oftentimes there can be a feeling of hopelessness or overwhelm that happens when people aren't feeling their best. And I know a lot of my clients can show up in my office feeling a little defeated about, maybe how things have been going in some of their other doctor's appointments, or with their progression or lack thereof with their health. And so just to remind them and to revisit the idea that there are probably quite a few items that they are doing that are supportive elements in their life, and to help return to those and really highlight the things that are going to be, I call them foundational principles when I'm
Mhm.
conversating with my clients. Like, these are going to be foundational principles that you're going to want to have for the rest of your existence. And those could be things like good sleep hygiene, or the fact that maybe they drink enough water. And so we may be celebrating sort of little wins, but those are still absolutely important to bring into the conversation, and to really excite those clients about, like, these are good things that you're already doing and we want to continue those forward. So we're not coming in trying to say, fix this, fix this, fix this, do this, do this, do this. We're also trying to say, what are the things that you're doing that are supportive elements? And then how could we build better support into your day or your week or your month, to allow you to continue progressing to those goals with your health or wellness that you may have.
Yeah, because we're really talking about long term, building foundation and creating wellness for the long term, so that people can feel more resilient to stress and be able to manage, difficulties that come their way, whether it's emotional or physical, and to be able to know that if they, follow their plan and they're implementing, whether it's gratitude or meditation or mindfulness, or, some of their self-care strategies, or whether they're, exercising every day or drinking enough water or getting enough sleep, that, all of those all those lifestyle changes that they can make really help sustain them for the long run, not just in the short run. So I'm
Yes.
just wondering, as we start to come to a close today, what are some of the things that you think that we'll be sharing and talking about, as we do this vlog moving forward, Haley?
Oh, such great questions. Well, I know we've talked to our team here at Vancouver Wellness Studio, and because we have such a colorful and beautiful combination of providers and strengths and their areas of focus, we've talked about bringing them on and really kind of highlighting not only what they do in practice, but some of their areas of expertise, if you will. So I know for me, I'm really excited to talk about food sensitivity testing. That is such a big piece of how I work with clients, and getting to the root cause and starting to uncover some of those nuances about their diet that are unique to them. And there's so much cutting edge science there. There's also so much controversy out there in the community about food sensitivity testing. So I look forward to diving a little deeper in for future conversations about that, and just how can food inflammation lead to even conditions like autoimmunity. And so for me, that's definitely a big part of my practice and something that I love. And I look forward to kind of unpacking that with you.
Yeah, and I would love to talk with you about gut health and the connection with gut health and mental health,
Yeah.
food, food as medicine, working with depression and anxiety, food supplements,
Yeah.
learning more about hormones and the effects of hormones on wellness, physical wellness and emotional wellness. I'd love to talk about sleep, because sleep is such an important pillar for health, and it's so impacted, by so many people are so impacted love to talk about trauma,
Yes.
healing the brain, just really, brain health. Gosh, so many great things. Cortisol and adrenal fatigue. All the things that I think really affect people, some of what maybe they're aware of. And a lot of times I think people just aren't aware of how significant some of these topics, are, and how much, their health is really being affected.
Yes, I feel like the topics are not going to be a problem for us to come up with because we have so many things that go on here at this wellness studio and within our own practices. And I know just even sitting in your office as a client and doing neurofeedback has been such a game changer in my own world. And so I definitely look forward to you talking more about this neurofeedback piece and explaining to our viewers just what is that and how does that play into this integrative medicine role. Because for me, it's just been so exciting to not only work in this environment, but to be able to then experience these different services that are offered and to just see in my own walk forward with my own health how huge these things have been at moving me towards feeling my best. So yes, I'm excited about future topics.
That sounds great. And also just, for you, Haley, just the incredible results that, I have clients who are on anti-inflammatory diets, really working to reduce the overall inflammation in their body, and how powerful food as medicine is, that I don't think I've been fully aware of until more recently, seeing just the incredible changes in people's lives as a result of what they're eating or not eating, and how, you know how much that changes their mood and their life. It really is powerful, and I don't think I realized that before until more recently, how truly powerful it is. So I'd love to hear more from you about that, and just to be able to give um, people hope that, there are medication for emotional or mental health issues can be important for people if needed, but there's alternatives too. And I think that that's really important to be able to share that for others too.
Yes, I definitely look forward to just exposing again some of these alternative therapies that go on and just their impactfulness. I think that's just so great for us to consider all of those things going on here at the studio. And then also, yes, we've lived them in our own life. You know, we've experienced it with our clients. We've seen the goodness that comes from the implementation of some of the strategies that we're suggesting, and just how we can get away from some of those conventional medicine. Here's a pill for what's going on for your illness, and really giving our clients that ability to see wellness in a different way, and the ability to impact their health in a more natural and foundational way.
I think that all sounds wonderful. So, on that note, I think we want to invite people to send us an email if they'd like to learn more about our services, if they have some topics that they want us to cover. We're looking for ideas for topics and want to, support people who are listening to this vlog. And then we're excited to bring in our Vancouver Wellness Studio team and other practitioners, providers in the community to share what they do, and to just increase awareness and support for our community and those who are interested in integrative medicine.
Yes, I look forward to it all.
All right. So on that note, we will say goodbye.
Yeah, thanks for being here.